One of the clinical aspects of combating COVID-19 is the ability to detect positive cases early, track and trace their contacts, and refer them for appropriate management, whether it is immediate testing, isolation, or quarantine. The digital system that the Department of Health is currently using is called COVID Connect. Brings an easy-to-use self-service portal to your cellular phone. It is freely accessible through WhatsApp and SMS. What also makes it more accessible is that it does not require for a user to have a smartphone, but it works on any mobile phone. This system enhances the physical effort of contact tracing and tracking, which is done by our community health workers and volunteers. It automates this traditional process and continuously engages the affected user. To explain this process further, the system works as follows. When a patient tests for coronavirus, the information is picked up from the lab form and informs the patient of the test results, whether positive or negative, by SMS. If the result is positive, the system prompts the patient for further information in order to identify their contacts. The system then immediately dispatches alerts via SMS to those contacts without disclosing the index patient's details and prompts them on the next steps to take. The non-disclosure of the patient's name is to ensure that their privacy is protected and also to make sure that after contact details are made available, that person's privacy is protected. In addition, the system can geolocate the nearest quarantine and isolation facility for the user and the nearest healthcare facility for patients or their contacts who are experiencing symptoms requiring medical attention. Users can also get the latest COVID-19 news and information, prevention tips and wellness advice at the touch of a button. There is also a simple risk assessment tool which will screen users for COVID-19 symptoms and give them advice on whether they should self-isolate or seek professional clinical assistance.
Meanwhile, South Africa has recorded